Hi, this is Dr. Parikh with Regen Medical, talking today about injuries and inflammation. Now, what happens when we twist our ankle, strain our back, or injure our shoulder? Well, the body triggers inflammation. And what do we associate inflammation with? We associate it with swelling and with pain, which is absolutely correct. And then we take an anti-inflammatory, or we put some ice on that area, because we think inflammation is bad. But what if I told you it really wasn't? Now, for decades, we've thought of inflammation as a bad thing. Now, chronic inflammation that's been around for a while, that's not good. But an inflammation that happens after an injury is necessary for healing. And the body inflames that tissue because there's more blood flow to that area. There's more cellular factors that are going to the area to heal up the injury and put down new tissue. Now, when you take that anti-inflammatory or put that ice on, you're reducing how much inflammation, and hence you're reducing how much healing you'll have to that factor. Now, how much we don't know from person to person. We just know that it's not likely going to be as strong as it could have been, and that could lead to chronic instability and pain. Because what's typically injured from an ankle sprain or back strain or shoulder injury? The ligaments and the tendons. And what we know is ligaments and tendons have very poor blood supply to begin with. Now, if we don't allow the body to bring more blood supply to those injured tissues, then we're making a very poor blood supply tissue not heal because you're not allowing more. Now, let me show you a graph that'll go more into this process. Now, this is the phases of wound repair. The first phase is inflammation. That's what this is. That's acute inflammation. Happens for the first 3 to 5 days or so. Then you get more blood supply. You get fibroblasts that come and start putting down more tissue, like collagen. That's collagen production. That's from day 10 or so all the way up to 400. So once you've placed that collagen, it's there. It works for a long time. But if you don't allow this process, then you won't get this process and so on. So that anti-inflammatory or that ice isn't necessarily good. Now, what if you're saying to yourself, well, I've already done that. I've already got unstable ankles or chronic injury that won't heal. Well, that's why regenerative medicine is so exciting. Treatments such as prolotherapy, platelet-rich plasma injections, and stem cell injections can actually work to heal up these injured ligaments and tendons. It can even work on arthritis pain. So it's an exciting area of medicine that I want to share with you, and just stay tuned for more.